Today is World Tuberculosis Day, an opportunity for the world to focus more attention on one of the top health challenges that affects more than 2 billion people around the world. It's estimated that there were 13 million TB cases in 2013, with 9 million of these being brand new cases. But the reality is that many of these cases may go undiagnosed or mistreated, resulting in the continuous spread of the illness if not addressed. Now, last week we spoke to Dr Jennifer Hughes, a drug-resistant TB specialist from Doctors Without Borders, who's been working with DR-TB patients in Khayelitsha for the past 7 years. Now I'm joined in Cape Town this morning with one of her patients, Goodman Makhanda, as well as DR-TB counsellor and a former patient, Busisiwe Beko. A very good morning to you guys. Thank you for joining us.
Morning.
Good morning.
Now, Goodman, it's World TB Day today. You've battled for the last 2 years with DR-TB. Tell us about your journey and how this has affected your life.
Good morning to South Africa. As you said, I'm Goodman Makhanda from Khayelitsha. I have XDR TB. It started in 2013 with the MDR. At January in 2014, the results came back as a XDR. It's when I was realized my life was ending. I was waiting for the day to die, but for the help of MSF and Busi next to me, they give me a hope, as today I've been converted from positive to negative.
That's fantastic news. Now, Busisiwe, both you and your daughter suffered with the illness. Just tell us briefly about your experience with drug-resistant TB and how this program in Khayelitsha helped you guys.
Okay, with me, my story, it started in 2005 when I was diagnosed, me together with my baby, when she was 5 months old by then. It really affected me because by then there was no decentralization, meaning which like the patients which are diagnosed with the drug-resistant TB were forced to go to hospital. Lucky enough now with the help of MSF in Khayelitsha, because they came up with a decentralization, because there was a challenge of shortage of beds, because I was also one of those patients who was waiting, dying to get in a hospital with no treatment. Lucky enough for the patients like Goodman, they've started their treatment at the clinic. So I would wish like it was happening to all of South Africa, that like the patients whom are diagnosed at the clinic levels, the one whom are able to go to the clinic every day could start the treatment at the clinic so that they can reduce the risk of infecting the others while they are still waiting for the treatment to be started in hospital.
Now, Busisiwe, you've stepped in and you help to counsel patients or people that are battling with the disease now. Tell us, what kind of support do you give them?
I give them the support, like, because if I compare with my case whereby there was no counseling at all, and now they've got a counseling whereby they can know about their disease and what they must expect around their treatment journey, meaning which like the side effects and how to practice the infection control and the challenges they may face, because really there are challenges. The duration of the treatment is long and the treatment is having side effects and there is a lot of pills. So I'm helping them. I'm also facilitating with the support groups whereby like I'm building the relationship among the patients, whereby, as Goodman has mentioned, that the minute you are diagnosed with the drug-resistant TB, you lose hope, and it seems as if it's happening only on you. So when I introduce them to the support group, it's whereby they meet and share and like try to comfort each other.
Goodman, tell us about the treatment that you received. How many injections and how many pills do you need to take every day? It must be quite difficult.
It's really difficult. It's only you must have a hope of maybe one day you will get cured and you will be free. The tablets are 20. The injection is for 6 months, so you get it from Monday to Friday for 6 months. Also, the medication, the tablets you're taking in, it gives you some side effects of you lose a lot of weight because you're gonna lose your appetite. You're feeling nausea and dizzy until the body tries to absorb and understand what kind of medication you are on. And then after that, it's when everything is back to normal. As you can see now, I'm gaining weight. If you can see, you won't say I have a XDR TB. I'm looking like normal, walking in the street like everybody.
And how has drug-resistant TB affected your family life and your job life?
That it was a shock of the life because I don't have a history of a TB person at home. We don't have a history of a TB. But what was also said, it's what I'm the first person to have a TB at home, and it was the first time to have a TB, but unfortunately I contracted MDR TB. About the case of the job, yes, it's really affect me because I was booked for 3 months at home without working, because they said I'm dangerous in a community.
Yeah, that's very difficult. Busisiwe, what's your message to people who are suffering with this illness? What do you say to them? Advice?
My advice is, yes, now we know that like the treatment is not that effective, but if they could stay and adhere to the treatment, because this is the only drugs we are having at the moment. So if they could just stay on treatment, and whatever problems they are having, they must just come forward with them, like to their doctors or their counselors or their clinic nurses, so that we can try and bring some sort of help to those patients. But at the end of the day, it needs like the commitment and even the community at large to come out and speak with drug-resistant TB, so that we can break the stigma, so that like it can be something which really we can talk about it.
Oh, thank you for joining us today. You're doing a sterling job in the community. That is Busisiwe Beko, who's a former DRTB sufferer. She works as a counsellor now, and she was joined by Goodman Makhanda, who is at the moment one of her patients. It's World TB Day today. How can you contribute to us coming to terms and dealing with this disease that is so very difficult to treat now?